Hello, I'm Jesse Wheeler, and I'm coming to you live from the couch. Today I'm going to be telling you a little bit about what I have learned in my research of speech language pathology. It's been an up and down research project. I've enjoyed the majority of it. It's been fun to learn about what I intend to go into in my future, so I'm going to tell you a little bit about it. We'll start by talking about the semantics of a speech language pathologist. What is a speech language pathologist? It's not just another conversation. A speech language pathologist is somebody who goes into a facility, whether it be a school or a nursing home, and helps people to correct their language, correct comprehension skills, or swallowing disorders should they have them. They can provide these areas of treatment and help people to get back to their normal functioning levels. To begin a career in speech language pathologists, you're going to have to take a few steps to get there. It's not quite an easy concept. It's a pretty difficult path, but it's definitely worth it in the end, I think. You have to start by getting a master's degree in speech language pathology. This is something that you can do after just about any four-year degree. It's favorable to have a linguistics degree, maybe a psychology degree, something that helps you to talk with other people, helps you to work with other people. But once you get into the master's program, it's a 2-year program, and there's a required externship or a residency, basically, that you have to go and work in an actual facility and do some hands-on care with somebody who helps you get through the externship. I think it's a 6 months externship, which helps you just to figure out what the actual career itself is going to be like. Some distinctions of an SLP. It's a pretty broad field. You have a lot of options. You can go into school system and help children who are struggling with basic speech sounds. A lot of times kids with speech disabilities will have stuttering issues, lisps, because they aren't in an environment where these speech sounds are presented to them very often. So they aren't quite sure how to produce these sounds. As a speech pathologist, you'll help them form the right sounds using their tongues, their lips, and stuff like that in order to help them make the correct sounds. Additionally, SLPs could work in a nursing home or a helpful care setting that can help older people or people who may have had brain injuries, Alzheimer's, dementia, help them to possibly reacquire skills and comprehension, help them to relearn how to say or do different tasks as far as comprehension and speaking, as well as helping with swallowing. This is something that is a lot more prominent in the older environment than it is in the schools, because somebody who has had a stroke or something like that might not have the best muscle control in their throat. So this is part that's not usually thought of as a speech pathologist, but it's crucial because it's very important to maintaining your speaking faculties, because it can help you to, or it can harm you as far as swallowing goes. You don't want to leave food in your throat or something like that. It can prevent you from producing the correct sounds, or even choking, which is, obviously one of the more prominent issues. So after you've decided whether you want to go into a school system or into a geriatric or nursing facility or a hospital even, you have to decide where you want to go, and on top of that, you have to find out the exact facility that you like. So you want to make sure that you look into the environment really well. You don't want to go to a school that doesn't have many options if you're looking to help with one thing, or you don't want to go into a nursing home if you're going to be required to do swallowing all the time, if what you're really interested in doing is helping somebody reacquire comprehension skills. So it's really important to do that type of research before you make any decisions. All right, so after you've made that decision, it's time to make some calls. Put on your best suit, get all dressed up fancy, and go talk to people. Just go out there and show your face, get your name out there. Maybe try and find out if you know anybody, do a little bit of interning, maybe shadow some people to see if it's particularly what you want to do, and maybe this will help you to be able to find a better position, better job in an environment that you're really interested in. One of the best things about this field is the job market is in huge demand right now for just about all speech pathologists, whether it be in a school system for children or in a nursing home. I'm personally interested in going into a nursing home as I have always found the swallowing aspect of it very interesting. I'm actually interested in going into the portion of the field where you'll do fiber optic endoscopic uh, videos of the throat, and it'll help them to determine whether or not their swallowing faculties are working appropriately. So once you've gotten in, once you've made it, you've done it, you got the job. Next thing you need to know is what the job's going to involve. I mean, you know at this point what a speech pathologist does, but you don't really know outside of the residency what you're going to be doing in the position. You have to know that you have to help therapy or help patients with therapy. You have to assign dietary guidelines in the nursing home, particularly where residents who have these swallowing issues need to have thicker liquids or thicker food because they don't have the ability to swallow the thinner liquids without choking. So you have to be on your A game when making these types of decisions in the work field. You're going to have to fill out a lot of paperwork. It's huge. In my interview with Erica Rady, she told me that there was tons of paperwork. It's the least fun part of the job, but it's essential to the job as it helps them to get Medicare and Medicaid and help them to fill out all their monthly bills and everything for the families. But most important, the biggest part of this job is just to really make people feel like human. I mean, I've been in a couple nursing home environments where they just don't do a very good job of making the people feel comfortable, feel at home. It's such a huge responsibility to make sure that these people are living at the best possible quality of life that they can. And my intent is to go into this field and just to do whatever I possibly can to help people out. I know you can only do so much for some people, but it's just a matter of taking those steps to do what you can. Cha-ching. Okay, so we've already gotten through the education, getting the job, but the pay's not too bad either. Going into a nursing home or a clinical facility, you can start out making $60,000 to $75,000 a year. Yeah, you might have a few $100,000 in student loans by this point, but you'll be making some good money. You'll be able to cover a good family living, and it's pretty good pay. In the school system, it's slightly lower. I think on average it's $60,000 a year rather than the starting pay, which will still pay the bills, but I definitely recommend marrying rich if you can. All in all, when it really comes down to it, I've chose to pursue a career in this field because it really does give back as much as you put into it. Um, if you take the time to get to know the residents, they really are all people. You know, they're living their life however they could. They've just gotten to a point where they've hit a bump in the road where they can't do the things that they used to be able to do. And in a nursing home, it's essential to really make sure that you can help these people do what they can possibly do. It's so difficult. I mean, it's hard to even imagine being able to speak your whole life and then all of a sudden losing that ability. It's got to be frustrating. So I feel like this career can be very rewarding if you're able to help somebody accomplish even the smallest tasks. You just gotta show a little love. That's all I'm asking. Maybe give back where you can. And that's about it. That's all I mean, I learned a great deal about this field, and I hope that maybe I shed a little bit of light on it for you to kind of understand what the field is all about. I enjoyed it. I thank you for giving me the opportunity to do a little bit of research on what I'm going to be doing in the future.